pé kò sí accident ò lè ṣe ó máa ń ṣẹlẹ̀. But to my own point of view, mo rí pé tí mi bá ṣẹlẹ̀ bẹ́ẹ̀, you have to go to other town láti lọ receive the treatment because there is not enough equipment.
Number one, mo fẹ́ ojú ọ̀nà ìgbàlódé tí wọ́n dọ̀dà sí tí ó máa yọ̀ kúlúlú bí ti ìgboro yẹn mo fẹ́ tàbí máa rí ọjà tà. Mo sì fẹ́ ná ìjọba kó wọ́n wà bá wa ṣe náà wa tá a bá ti rí méjèèjì ni àdúrà wa gbà ní ìlú Òṣogbo.
If an armed attack happened here today, help would be difficult to find because beyond this building, there is almost nothing else. No security, no fence, no neighbors within immediate reach. Only thick vegetation stretching into the distance. And somewhere within it stands a government primary healthcare center. This is Olugbade. For the people who live here, this facility is expected to be the first place to seek help during illness. It is where pregnant women should find skilled care, where sick children should receive treatment, where emergencies should meet immediate response. Instead, many residents see something else: an isolated building, an understaffed facility, a health center struggling to survive in silence. For months, vigilants traveled across rural communities in Oyo State to understand whether primary healthcare is truly reaching the people it was designed to serve. What we found was not simply a story about hospitals. It was a story about roads, about fear, about broken promises, and about communities where the healthcare journey has become almost as difficult as surviving without it. The journey to Olugbade feels like leaving the rest of Oyo State behind. The further the road stretches, the fewer signs of government remain. Then, almost unexpectedly, a modest building appears beside the road. Without its signpost, many travelers would never know it's a primary healthcare center. There is no perimeter fence, no visible security personnel, no patients waiting beneath the trees, only silence. During our first visit, only one person was there, the cleaner. When we returned days later, it was the same. Again, only the cleaner. Her name is Halima Olanrewaju. She earns 15,000 naira every month. Yet, on the days we visited, she was the face of the health facility, receiving visitors, keeping the premises open, waiting. Primary healthcare was never designed to be distant. It was created to bring essential medical services closer to ordinary people, especially those living far from urban hospitals. It is the foundation of Nigeria's healthcare system, the first point of care. Through the federal-backed Basic Healthcare Provision Fund, governments continue to invest in strengthening primary healthcare centers across the country. In Oyo State, the government has repeatedly pledged to improve healthcare delivery through upgraded facilities, expanded services, and greater access to quality healthcare. But beyond official statements and government reports lies another reality, one that can only be understood by traveling into the communities themselves. The journey to Osogun begins with a road that gradually disappears.
Health center tó wà lọ́dọ̀ wọn báyìí ìjọba ń gbé èèyàn wá ṣùgbọ́n wọn ò kì í sòó dúró. Àkọ́kọ́ ibi tí wọ́n máa gbé ìlú ní ọ̀sẹ̀ máa ó sì pé bo ni wọ́n gbé. Torí tẹ́lẹ̀ tí wọ́n bẹ̀ tẹ́lẹ̀ wọ́n kọ́ everything quarters ambulance borehole everything wà tó dẹ̀ ń lò but for now kò sí ẹ̀kan mọ́ ń sìn. Ìlú lọ́sẹ̀ ń fún wọn níbi tó ń gbé inú ìgboro ń bí báyìí. But ọmọ tó ń gbé láti Ògbómọ̀ṣọ́ tàbí tó ń gbé láti Ìbàdàn tó kò lè rí ọ̀rí báyìí láìsí iná.
Nígbà tí àwa wà ní kéékèèké gbogbo ẹ̀ lọ́wọ́ ń bẹ̀ ṣùgbọ́n ní ìsìn kò sí gbogbo ẹ̀ mọ́. Ohun tí òjò símọ́ ni wípé ní ìgbà tí a wà ní nǹkan bí 1975 sí àsìkò nǹkan òṣìṣẹ́ bíi 90 kẹ̀kan. Ètò ìlera ó wà dáadáa nílùú Òṣogbo. Ta ní ambulance, a ní doctor, a ní gbogbo òṣìṣẹ́ ìjọba, òṣìṣẹ́ elétò ìlera ló wà ń bẹ̀ tí wọ́n máa ń gbẹ̀bí tí wọ́n máa ń ṣe nígbà yẹn. Ṣùgbọ́n gbọ́ yá àwọn Anglican, àwọn ìyàwó àwọn bishop, àwọn wọ́n ṣètò tí wọ́n kọ́ àwọn missionary, àwọn ni wọ́n kọ́ ilé ògùn yẹn. Nígbà yá wọ́n gbé fún local government. Nígbà local government táwọn gbà gbogbo ohun tó wà ń bẹ̀ àmọ́ bóyá jẹ́ bóyá àwọn ìjọba lọ́wọ́ àpò ni o bí kíní ni wọ́n sásọ di maternity ni wọ́n bá lọ di sí yìí. Ṣùgbọ́n ní ìsìn kété tí à ń ṣe ètò kan wá ti wà tí àwọn ìjọba federal tí wọ́n gbé wá láti Àbújá tí wọ́n máa wà fún wa ní oògùn ọ̀fẹ́. Àwọn eléyìí wọ́n ti jókòó ti iṣẹ́ yẹn tó jẹ́ pé bí ààrẹ èèyàn yá wọ́n fún ní oògùn ọ̀fẹ́. Bí kò sí ohun tí a gbé débẹ̀ tí wọ́n ò gbà wá tọwọ́ tẹsẹ̀, wọ́n dẹ̀ ń tọ́jú wa dáadáa.
Àwọn nǹkan tí ó ń jẹ wá níyà yóò múnú dùn tá a sì làkàkà láti ní tọwọ́ ò tí ì tó tẹ̀wé àwọn ìjọba rántí wa ra lẹ́ni níbẹ̀ lókè nísìnyí. Ojú ọ̀nà tí baálẹ̀ sọ pé oúnjẹ wá yẹn ẹ̀yìn náà rí ẹtìlẹ̀ rí gbàtà mi. Ṣùgbọ́n àwọn nǹkan tí ó ti kú lọ rí níbí yìí nílẹ̀ yìí tẹ́lẹ̀, ọjà màyẹ́ ò sí mẹ́gbà yẹn, ọjà yìí ló máa ń ná, ọjà Òṣogbo gbogbo ẹ̀ wọ́n máa ń tilà láti Èkó, Ìbàdàn, Ìṣẹ́yìn wá ná. Wọ́n ní ọdún mẹ́ẹ̀ẹ́dọ́gbọ̀n sẹ́yìn ta ni màyà ti dé tàbí ọjà kankan mọ́. Lè yàtọ̀ sí yẹn omi wa ní òtó nǹkan. Àwọn tó jẹ́jọba wọ́n fún wa lómi bíi 4, ṣùgbọ́n wọ̀ kárí wa aládàáni náà wá fún wa àtún nídìí omi yẹn kó bá a ṣe dáadáa.
À ń fẹ́ oore ọ̀fẹ́ látọ̀dọ̀ Ọlọ́run, látọ̀dọ̀ àwọn tó lè ràn wá lọ́wọ́ nínú ìlú tí a wà yìí. Torí tí ẹnìkan bá ní àìlera díẹ̀ tó wọ́n máa ń ṣòro fún wa níbi tí a wà yìí. Torí kò sí ibi tí a ń lò àwọn Anglican lọ àwọn missionary tó ní right but wọn ò fi ó bá sí pẹ̀lú wa látàrí pé kò sí àwọn oríṣiríṣi nǹkan tí wọ́n lè máa lò bíi iná, omi. Tí iná bá ń lù kan ibẹ̀ máa ń wà lively but tí ò bá ti síná ibẹ̀ á dàbí oko.
At the end of the journey stands Bishop Ajayi Crowther Primary Healthcare Center. Quiet, aging, almost hidden. The facility sits behind thick vegetation as nature gradually reclaimed much of the surroundings. Bushes now cover abandoned structures that once supported healthcare workers. Only a faded signboard tells visitors they have finally arrived.
Lórí ọ̀rọ̀ ìdàgbàsókè Òṣogbo, ó jẹ́ ohun tó máa ń pa mí lẹ́kún ní ọ̀pọ̀ ọ̀gbà. Torí èmi tí mo jókòó yìí, ìlú yìí ni mo ti lọ primary school, tí mo sì kúrò ní ìlú yìí 1977. Ìlú yìí ń dàgbàsókè láti ìgbà yẹn díẹ̀. Ṣùgbọ́n gbà tó yá, ìrẹ̀wẹ̀sì dé, gbogbo nǹkan lọ ọlẹ̀ pátápátá. Gẹ́gẹ́ bí ohun tí a rí ńgbà táwa wà nílé ìwé alákọ̀ọ́bẹ̀rẹ̀, ọjà ìlú tó ń kún jù ní l'Ékòó, n'Íbàdàn. Gbogbo àwọn èèyàn wà lọ́pọ̀lọpọ̀ nísẹ̀yìn lóríṣiríṣi ìlú wọ́n ti wá ná ọjà yìí. Ó kù ọ̀la tí wọ́n ná ọjà yẹn làwọn èèyàn ó ti pọ̀, tí mọ́tò ọmọ lọ, tí mọ́tò ọmọ bọ̀. Ìgbà náà ni àkókò kòkó gbígbìn. Àwọn bàbá tí wọ́n wà nínú ìlú yìí, àwọn náà ṣẹ̀ṣẹ̀ já sí òwò kòkó, wọ́n bẹ̀rẹ̀ sí gbin kòkó.
The journey itself explains why many residents really do. Today, many of those memories survive only in conversation. Our biggest challenge is the road, says the traditional ruler of Oshogun, Olalere Moses Adebamiji, the Oloshogun of Oshogun.
Kùdìẹ̀kudiẹ tó kù ní pé a fẹ́ kí wọ́n bá wa wá àkọọ́lẹ̀ oògùn tó dáa sí ibí yìí torí pé ilé oògùn tí wọ́n kọ́ síbí tí àwọn Anglican kọ́ síbí yìí àwọn missionary yẹn àwọn náà ti fẹ́ gba nǹkan wọn padà. A fẹ́ kí ìjọba ràn wá lọ́wọ́ kí wọ́n wá àkọọ́lẹ̀ oògùn tó dáa fún wa ní ìlú Òṣogbo.
In Oshogun, the community's only primary healthcare center remains physically separated from many of the people it is meant to serve. Distance has become another barrier to treatment. Some residents admit they now seek help from informal medicine vendors and traditional healers rather than attempt the difficult journey to the facility. The challenges facing Bishop Ajayi Crowther Primary Healthcare Center do not end with the road. They continue inside the facility every afternoon. At about 3 o'clock, the health center begins to close, not because the work is done, but because those providing the care no longer feel safe enough to remain. Only 3 women run this facility. Together, they provide health care for Oshogun and surrounding communities. But when daylight fades, so does their sense of security. The bushes surrounding the facility have become a source of fear. Just weeks before our visit, community vigilantes arrested 2 suspected kidnappers living in a house close to the health center.
Ìgbà wọn campaign ní 2019 gbogbo àwọn ìṣòro yìí la kọ sínú ìwé lẹ́yọ kọ̀ọ̀kan fún wọn. Èmi náà ni mo kọ́ bàbá wo Olóṣogbo yìí náà ló ń bẹ́ẹ̀ pé àwọn ìṣòro tá a ní nìyí wọ́n sọ wípé àwọn ìṣòro yìí ó dàbí ẹ̀yìn tí eégún fi sọ títí di àkókò yìí kò tí ì dàbí ẹ̀yìn o lórí wa náà ló wà bí ẹ̀kú eégún kò sì yẹ kó rí bẹ́ẹ̀. Ó yẹ kí ìjọba ìpínlẹ̀ Ọ̀yọ́ wò wípé àwa náà nínú ìpínlẹ̀ Ọ̀yọ́ la wà Ward 2 ni wá ní Ìṣẹ́yìn local government.
The decline of healthcare in Oshogun did not happen in isolation. It mirrors the gradual decline of the community itself. For many residents, the story of the primary healthcare center cannot be separated from the story of the road, or the economy, or the promises they say have remained unfulfilled. There was a time community elders recall when Oshogun was a destination. Every 5 days, traders from neighboring communities gathered here. Today, much of that activity has disappeared. As the road deteriorated, movement became more difficult. The market gradually collapsed. Residents say the consequences have extended beyond commerce, affecting education, healthcare, and the willingness of professionals to live and work in the community.
Àwọn ìjọba rántí wa ojú ọ̀dọ̀ tí baálẹ̀ sọ pé oúnjẹ wáyà ẹ̀yìn náà rí ẹtì lẹ́rí gbàtà mi. Ṣùgbọ́n àwọn nǹkan tí ó ti kó lọ rí níbí yìí nílẹ̀ yìí tẹ́lẹ̀ ọjà màyẹ́ ò sí mẹ́ngbà yẹn ọjà yìí ló máa ń ná ọjà Òṣogbo gbọ́ngbọ́n wọ́n máa ń tilà láti Èkó Ìbàdàn Ìṣẹ́yìn wá ná. Wọ́n ní ọdún mẹ́ẹ̀ẹ́dọ́gbọ̀n sẹ́yìn ká ní màyà ti dé àbí ọjà kankan mọ́. Lè yàtọ̀ sí yẹn omi wa ní òtó nǹkan. Àwọn tó jẹ́jọba wọ́n fún wa lómi bíi 4 ṣùgbọ́n wọ̀ kárí wa aládàáni náà wá fún wa a tún nídìí omi tó bá dáadáa.
Number 1 mo fẹ́ ojú ọ̀nà ìgbàlódé tí wọ́n dọ̀dà sí tí ó máa yọ̀ kúlúlú bí ti ìgboro yẹn mo fẹ́ tàbí máa rí ọjà tà. Mo sì fẹ́ náà ìjọba kó wọ́n wà bá wa ṣe náà wa tá a bá ti rí méjèèjì ni àdúrà wa gbà ní ìlú Òṣogbo.
This investigation raises a broader question. What does accessible healthcare truly mean? Is it enough to build a primary healthcare center, or should that facility also be safe, properly staffed, equipped, maintained, and close enough for the people it was built to serve. The cleaner will return tomorrow. The nurses will unlock their doors again. Patients will continue to make the journey, and the communities will continue to hope that one day the road to healthcare would no longer be the hardest part of receiving it, because no community should have to travel this far to find care.